Good morning. Welcome to our health practitioners call. Really pleased to have Dr. Stefano Scoglio with us today. We are going to focus on talking about some of the science of Clamex. You've spent 24 years of research on this with 8 clinical trials, 10 scientific publications, and 6 patents. Pretty impressive, Dr. Scoglio. This is amazing.
Thank you. Yeah. Well, actually, the actual research has been in the last 18 years, more or less. Yeah. I've been involved with the algae for 24 years. Yeah. And then,
I have a question. I've had a few people call in that are not connected with Igalen, but some information I've given out about Clamex, and they said, well, what's the difference between your product and a blue-green algae that I can get off of Amazon? That's the question. I go into it. I would like your dissertation on that, and I know you're going to give a good one.
Yeah. I mean, there's a huge difference, clearly, in the sense that alpha algae is a very good product in itself, but what it is mostly it's very good for nutritional purposes, because it has a wide array of vitamins and minerals, and of course some of the fundamental molecules that also compose Clamex are present there, but are present in a quantity that is very, very low. Just to make a comparison, usually in the algae, overall algae, you get about 2-3 milligrams of PEA, of phenylethylamine, which is a fundamental component of the product. In fact, possibly together with the alpha phycocyanins, the 2 fundamental molecules in the product. 2-3 milligrams of PEA means that excuse me. There's been studies that have been done, for instance, on depression, and they saw that a minimum activity was perceived starting from 10 milligrams up, 10 to 60 milligrams. So that means that you would have to take quite a few grams of algae to have some kind of effect. Here in Clamex, just in one dose, you have about 15 milligrams, 5-6 times more concentrated PA, because Clamex is composed of 2 extracts that concentrates these most fundamental molecules, while retaining, of course, or concentrating some nutritional molecules as well. But fundamentally, the clamine, the Clamex is composed of 2 extracts from AFA, clamine, which is concentrates the small size molecules, so particularly phenylethylamine and mycosporin-like amino acids, so-called, which are the two present in Clamatalgia, called porphyra and chinorine, and also probably some polyphenols. We're looking into that, because one thing we discovered recently, we knew already that there were polyphenols in the algae, for instance, caffeic acid, but we never really explored that. And recently, in Palermo, with the National Center of Research in Palermo, Sicily, in Italy, they actually did a full spectrum of polyphenols, and they were totally impressed, because they thought that it was the widest spectrum of polyphenols they've ever seen, and also at a relatively high concentration. So I'm actually going in March to meet with these guys, trying to get a more specific breakdown of all the polyphenols present. So the clamine concentrates these parts in the algae, especially PEA, phenylethylamine, mycosporin-like amino acid, and the other extract that composes Clamex is called Afamax, and concentrates mostly the molecules which are the phycocyanins, which in Clamatalgia have a special structure compared to, for instance, other phycocyanins from, let's say, spirulina, and but in any case, going back to the comparison with the alpha algae, usually in the algae, in the whole algae, you get about 5%, 5-6% concentration of phycocyanins, and again in alpha max you get 25 to 30%. So again, 5-6 times. So it's the function of the two very, very different products. You get like in just 1 gram of Plamax, you have such a high concentration of these fundamental molecules that you would have to take like, minimum 6 grams a day of algae to match the same. And even with that, I'm not sure it would be the same effectiveness. So yeah, it's a very, very different product relative to the regular AFA. But having said that, regular AFA is a very good product. No, I'm not.
Right. So some of the research you've seen that we have seen with this, the lipid peroxidation issues.
Right.
There has been support with macular degeneration, depression, neurodegeneration, hepatitis, and cardiovascular disease.
Yeah. One of the things that I find really, I have to say that I'm very impressed by Climax in the sense that my work and my study has always been done by using the two extracts separately, because we talk about the fact that this is a stem cell releaser and that's one of its fundamental functions, but there's much more than just that. And essentially what we've looked into our research so far has actually been mainly looking at the specific function of each of the two separate extracts, right?
Right.
I have to say that putting together the two extracts seems to produce results that are, in a way slightly unexpected for me too. I mean, I'm seeing reports and testimonials that are absolutely amazing with very, very deep results in very, very short time. Mm-hmm. So the reason for that could be that, the synergy of these two extracts really works, at 360 degrees on human health. We talked about, lipid peroxidation. You mentioned clearly there the components like alpha phycocyanins are fundamental, and as I explained other times, we found this amazing result that in all the studies where we tested lipoperoxidation through MDA, malonyl-dialdehyde, which is a byproduct of lipoperoxidation of the oxidation of the lipid membrane of cells. So you can actually test, the oxidative status of people by looking at the MDA concentration in their blood. And in all the human studies we did and where we tested MDA, there was always with alpha max, but even with clamine, interestingly enough, a reduction of between 35 to 40% MDA, which to me it's pretty amazing, because it means that based on other studies, for instance, animal studies where we could see the increase of MDA when you increase oxidation, which is about 40%, clearly means that what I say is you move from the pre-pathological level of lipid peroxidation to a physiological level, because we all know that free radicals are produced naturally and physiologically daily by cell energy production, by the immune system and so forth. So a certain level of MDA is actually physiological. It's part of our constitutional being. Problem is when MDA increases, usually about 40%, as I said, I've seen in animal studies, and that generates this constant harming of cells all over, and that's why MDA has been associated with, macular degeneration, heart disease, all sorts of degenerative diseases, hepatitis, and so forth. So bringing it down 35-40% regularly means clearly that the product is able to cut down that excess MDA, which generates the pre-pathological condition, and brings it back to a physiological condition. So this by itself should suggest that everybody should take it, yes, just to prevent any risk of disease degeneration in their life. One other thing that I find absolutely remarkable is that we're discovering more and more roles for these molecules. For instance, historically, I've known, and we've known, and I've seen that high quantities of alpha algae, of the whole algae, all these extracts, have a very good effect on blood pressure and on the normalization of blood pressure. And now it comes out in the last 5-6 years, it comes out that the heart has actually special receptors for the trace amines, like PA, like phenylethylamine. So phenylethylamine is actually considered a blood pressure regulator, which is a further aspect of this molecule, which has always been known as a general neuromodulator with very powerful activity on all the neurotransmitters. But now it's come out, as I said, that it regulates blood pressure. And now recently has been shown, 4 or 5 years ago, that all the immune cells, NK cells, macrophages, T cells, B cells, they all have receptors for PA. They're called TAAR1 and TAAR2, trace amine associated receptor 1 and 2. There's like 9 or 11 that they've been discovered so far, but the 1 and 2 are the two most studied and known ones. And they're all present in the immune cells, so that when phenylethylamine attaches to them, they migrate and they go to do their work. Now, again, we knew by experience that was the case. It was studied, it was found already like 10, 12 years ago that when you take 1.5 grams of algae, there's a mobilization of the immune cells for 3-4 hours. And in fact, that's why we advised to take maybe 1.5 gram 3 times a day, 3-4 times a day, if you wanted like a full scale activity on the immune system. And we knew that this mobilization of immune cells, for instance, particularly natural killer cells, up to 40% migrate from the blood to tissue for a certain number of hours, 3-4 hours. But again, it wasn't clear which were the molecules responsible for that activity. And now we know it's again PA, which means again that in a product like only a product like clamine, which concentrates PA to very significant level, can have such a powerful impact on the immune system, which is another of the reason why I believe with Clamax you have this 360 degrees activity, because it's immunomodulator, neuromodulator, and heart rate modulator. It has this powerful antioxidant activity, very powerful anti-inflammatory activity. We just discovered, we did this study at the University of Urbino in my hometown, where they actually found that the alpha PCs, alpha phycocyanins, are active already at the level of nanomolars, which means again, when you put 150 milligrams of in one dose of Clamax, you have like about 150 milligrams of alpha phycocyanins. When they get around your body, the anti-inflammatory activity is very, very significant. So again, when you put together all these things at the same time,
yes,
all these activities at the same time, clearly you give the body, as somebody was saying the other day, the day before in Vancouver, said, it's like you're giving the body everything it needs to fix itself, right?
Yes. Well, it's considered, I look at this, and I know the other docs here, when you look at this, it's truly the remarkable anti-aging product.
Yeah.
And Doc, touch a little bit on how the stem cells are released, how this
Right.
affects the stem cell release in the body.
Yeah. Well, let's say that, as you probably know, all this field of stem cell is very fluid and is not extremely clear yet. But two things we know for sure about climax and stem cells. We know that stem cells, there's many different types of stem cells: the hematopoietic, mesenchymal, neural, testicular, and every day they discover more. But essentially, the fundamental ones are, I would say the hematopoietic, mesenchymal, and neural. These are the three fundamental ones, because, of course, the hematopoietic are at the root of all the blood cells and immune cells, and the mesenchymal are about all the osteoblasts, fibroblasts, and chondroblasts, and so forth, the structure. And the neural, of course, are the progenitor of all the neurological stem cells and the neurotransmitters and the neural tissues. So now, how do they work? I mean, we all know that they're very powerful. They're very present in the embryo. They're much more present in young humans, adult stem cells, and with age they decline, right? Which is one of the reasons why finding products that can actually sustain and increase the production and the release of stem cells is actually important also for anti-aging. Now, the way they work, they reside mostly in bone marrow, at least the mesenchymal and the hematopoietic. The neural are in the brain, and what we found, is that, for instance, a fundamental role on the mesenchymal and the hematopoietic is played apparently by phycocyanins, because it has been found that phycocyanins actually, what they do, they stimulate the release and migration of stem cells in an indirect way. They significantly increase, apparently up to sevenfold, eightfold, 8 times the production of this urokinase-like plasminogen, which is actually a precursor is an enzyme that turns plasminogen into plasmin, which in turn it's at the root of all the fibrinolytic and the proteolytic processes in the bone marrow, and through these fibrinolysis and proteolysis, like with enzymes like metalloproteinase, the niches in the bone marrow where these stem cells are kept are kind of broken down enzymatically, and that releases the stem cells into the bloodstream. Now, one of the mechanisms that has been found then to attract these stem cells from the bloodstream to the tissue where actually they're needed, it's through immune mediators like cytokines, globulins, and so forth. And here there's a further element which I find very interesting, and that is how do stem cells know once they're released and then they're in the blood, how to go where they're needed.
Right.
Right. And here comes the second element of synergy, which is very important, because most of the people, as we all know, are affected by what we call the silent inflammation, generalized inflammation. So that means very likely that in most people, the message is very confused, because you get cytokines from everywhere in the body. And so one of the reasons why the self-repairing mechanism doesn't really work is also because stem cells don't know where to go. They have all these messages from everywhere. And again, the powerful anti-inflammatory activity of phycocyanin on the side, which, through the reduction of lipoperoxidation, through the reduction of inflammation, it's possible, it's an hypothesis, but it's possible that, it cuts down on that general silent inflammation, so that actually the message from the lesion comes clear, because that comes from actually non-generalized inflammation, but from a specific lesion. And so, you know, at some point that the message arrives and the stem cells know where to go, which again, I find, you know, another very interesting effect of this, you know, kind of synergy of the different components of Climax. Now, this concerning the more somatic stem cells, hematopoietic and mesenchymal. On the neural stem cells, again, we don't know exactly all the details of it, and it's certainly one thing that I would like to, you know, deepen in terms of research in the future. And I'm already doing some research, some specific research with, again, this National Research Center in Palermo on this. But what we found through this study that we did on mice, we found that clamine stimulated in the brain of the mice, you know, five times the production of cerebral erythropoietin. Now, what is remarkable here is not just the fact that there was a 500% increase in erythropoietin, which by itself is a huge number, but there was also a 300% increase in erythropoietin receptors, which means the product clamine in the brain of the mice actually was able to modify the structure of the brain and the plasticity of the brain, and stimulates in pathways that, you know, we haven't really explored, but generate the production of new receptors in the brain. Now, this is, of course, very important for neural stem cells, because erythropoietin, cerebral erythropoietin, is the precursor of all the neural stem cells, which in turn are the precursor of neurotransmitters and neural tissues. So this is the only datum we have, but it's a very, very relevant datum, because you know, cerebral erythropoietin is being studied now as a potential cure for all sorts of neurodegenerative diseases, starting from multiple sclerosis. I know that they've created a drug which is called recombinant erythropoietin, which, though it's very little effective and full of pretty devastating side effects. And, you know, many researchers in the field, you know, claim that, you know, it would be important, rather than giving synthetic erythropoietin from the outside, to, you know, stimulate the endogenous erythropoietin from inside. And unfortunately, they still don't know that, you know, clamine actually does that. So that's the other area. So again, you know, Climax in general seems to have this ability to work on all the stem cells in different through different molecules and through different mechanisms.
So we're looking at support for stroke victims, for Alzheimer's, dementia, any type of injury, what these stem cells can do to help recover that.
Yes, absolutely. I personally have seen during the years, without maybe not even knowing how exactly, but I've seen great results on Parkinson, Alzheimer, multiple sclerosis, stroke recovery, and so forth. So let's say that now we just know more why, and we don't know enough, but we know enough to understand that it can help in all those situations. We've actually just completed a study on dementia, on senile dementia, and we're looking now at the data. It was a very difficult study because the groups of people were people in a kind of old age institution, and they were very, very advanced, meaning in their dementia. Some of them, in fact, died during the trial. In spite of that, in spite of the difficulty of the case, because we weren't talking about, you know, beginning dementia, we're talking about people really, really gone in many ways. But there was kind of what I've seen from the data, which haven't been fully analyzed yet. But the first impression I had when I saw it, I saw that there was kind of a two type of effects. Like 50% of the people were stabilized. In other words, in 3 months, in the 3 months of the study, there was no further progression in spite of their, conditions very advanced, and actually half regressed. And some reported also, really coming back to life. So I think it was only a preliminary study in a very difficult situation, but again, will be a study showing the ability to work even in cases like this. And one other thing I want to say, you probably, I mentioned before the fact that we just come out with the study on ADHD. This is another product, great product for ADHD or, all sorts of children problems of that type, learning disabilities and so forth. I mentioned already sometimes the fact that the chief researcher, who is this child neuropsychiatrist, very official, very standard, and therefore normally very close to anything that is not a drug, but he had to change his mind about clamine just because he saw the effects. And he himself came to me and said, look, I've seen 25% of the children who participated in the study were also affected by autistic symptoms. And I've seen very important changes in these people. So maybe we should do a study on autism, since on autism there's no drug, not even a drug, so there's nothing to do. So he was kind of, in a way, I suppose, more relieved by the fact that he didn't have to compete with a drug. So we're probably are going to do a study like that. But just again, in Vancouver 2 days ago, I met a lady, a mother, who actually said that she posted a testimony on her page about her autistic child who started Climax about a month ago, and she's already seen very remarkable changes in the child. Right. So this is another area that may be very, very interesting.
Autism is skyrocketing, ADHD is skyrocketing. We know diet plays a big role there. Genetic factors have definitely involved in the issues with autism, heavy metals, chemicals, and so. Right. How does this affect the area of detox and cleansing?
Yeah, actually, this is another interesting question, because again, in the testimonials that I see coming up in these first 2-3 months that we've started distributing the product, there's a lot of detoxification. People reporting, nausea, maybe the first day or two. I've actually seen 2-3 cases of people actually vomiting, but they were people, maybe who had done chemotherapy or very intoxicated. Right. So certainly the detoxification is deep. Now, the way it's done, it's certainly, again, probably through the liver. The phycocyanins are very powerful liver protectors and stimulators of activity, but all the organs, the kidneys and so forth. One thing that I can say, and again, is another area where I'd like to do some research, but there's only much I can do. But we know that there was a study done by, I think, by the Hospital of the Army in Washington, many years ago, where they actually used planktonic microalgae, a cyanobacteria from plankton, and they actually discovered these molecules called phycokeratins. They call them phycokeratins, stating that they actually absorbed 30% of their weight in heavy metals. And I've seen personally a lot of cases in which many people who are very intoxicated by heavy metals, maybe after a month of being in a product like this, they feel a metallic taste in their mouth. So there certainly is a very deep cleansing activity, also sequestering activity with heavy metals. It's something that actually recently I think there's a doctor who contacted us in Italy and said he wants to do a study on chelation of heavy metals. Yeah.
What about the effects of, have you seen any results in the effects of radiation and in the area there, resulting in the detox and cleansing?
No, personally, no, and I haven't done study on that, but I know that I know reports on that alpha algae was sent and used after Chernobyl with apparently good results, but again, it's very anecdotal, and okay. I don't know. But I would think that there could be a very significant effect also there. I have to say one thing. I can say I've used, for instance, Afamax with very good results, both on chemotherapy and radiotherapy, in terms of ability to significantly reduce, in fact, eliminate practically any bad side effect of chemotherapy, but also radiotherapy, which makes me think again that there's some kind of protective ability also against radiation.
Yeah, that's great. Depression is with the PEO or the EPO. Depression has been Climax has been a very great support for the area of depression.
Right. Yeah, there we have there we have a few studies that we've done, and certainly is one of the areas where you can see the result more quickly. We've had a couple of studies. Well, we did actually studies, quite a few studies actually. We did it on menopausal women who were depressed with very good results on depression and anxiety. We're just about to publish now. I think it's about to be published, a study on terminal cancer patients with clamine, with very good results on depression, anxiety, and improvement also fatigue. What I find remarkable in this area is that it's a very powerful antidepressant, but works exactly the same on depression and anxiety.
Oh, wow.
Which, all the studies we did, the results on depression and anxiety were always exactly the same. And it's interesting because usually, if you get something that is for depression, may create anxiety, and vice versa. If you get something like for anxiety, it gets you depressed. But here you have this neuromodulator that actually, balances out both of them, bringing it back to the center. And one thing that also I keep finding as a report is that people experience this kind of calm increase of energy. I don't know how to say it, kind of a calm rush of energy. You feel more alert, more focused, more energetic, but at the same time, more calm, less stressed out, and more centered. Which again, I think it's pretty peculiar and unique of this product, as far as I know.
Yep. Any questions?
Yes, Dr. Nelson, I had some questions around thyroid. I believe I had sent them in an email to you, Doctor, to do with cancer and thyroid and a few things like that. People's level of having to increase their synthroid now and things like. Just wondering what the effects on thyroid are and how that works.
Yeah, let's say that, okay, one thing, first of all, is that there's no particular stimulation of thyroid. So even hyperthyroidism condition have never been badly affected by clamine or Afamax. as far as I know. And one of the reasons for that, of course, usually the warning is, oh, well, it's an algae, so iodine, too much iodine stimulates the thyroid and so forth. No, in this case, it doesn't apply because this is not an algae. The cyanobacterium looks like an algae, but has nothing to do with algae. It's a prokaryote and lives in sweet waters with very little salt, and the content of iodine, there is iodine, but it's about 15% of the daily requirement. So it's a small dose, useful, but absolutely small. And I've seen people who could, hyperthyroid people who could not even take spirulina, for instance, which is actually a very, again, is a cyanobacteria too, so it's not an algae, but grows in very saline waters, and so has a much higher content of iodine, but they could take, half algae without any problem. Now, having said that, I think the effect on thyroid is actually very, very good. We had a study that unfortunately we haven't been able to publish, that was presented at a congress where endocrinologists at the Hospital of Urbino tested Hafamax on 80 cases of Hashimoto with very, very good results. In fact, we had these Hashimoto patients who were coming enthusiastic about the product and how they changed their life and how they're feeling so much better and so forth. So, yeah, and actually recently I saw a case which I found interesting. Now I don't remember very well, but let's see. There was a lady that was posted on Facebook. She had is it possible she had some kind of insulin lowering or something like that, and it came out that she actually had a cyst or a benign tumor on her thyroid, and she started taking Climax, and she had this effect on insulin. And my interpretation of that was that probably the product started working on getting rid of the benign tumor, and that in itself activated thyroid hormones, which are known to lower insulin. So that was kind of an interesting case that I haven't, it was just an impression, but I thought it was interesting what was happening there. But yeah, again, there's no risk of any type for the thyroid, and actually so far what we've seen, it's always very, very good results. Another thing that I wanted to say is that I also, Hashimoto, as you know, is an autoimmune disease. Now, apart from the idea of autoimmunity, which is a very, I don't know, it's a very questionable idea, but in any case, I'm of the school that, anything autoimmune has to do probably with leaky gut syndrome, and the formation of circulating immunitary complexes, and the deposit of this CIC in tissues and so forth. I have to say Climax is very active also at that level, because it has been shown that phycocyanins are also able to intervene on this CIC, decomposing them. And also there's another fundamental element of phycocyanin, which is their amazing wound healing ability. Mm-hmm. I've shown some cases of, in my slides, of diabetic foot lesion, which was actually healed and closed by applying Hafamax on it, either directly or through the transdermal device. Mm-hmm. And I personally think that one other thing that Climax does, it really contributes to the restoring of the intestinal permeability, intestinal membrane. Now, certainly that would be much better if associated with a proper probiotic, and that's where our research actually is moving now, because I may have mentioned the fact that one of my patents and one of the field of research that we're doing now is the application of Hafamax to probiotics, and we've seen amazing results. Growing the probiotics Afamax, we actually had they become immortal essentially. They don't stop growing for on one end, and also they double or triple their antibacterial ability against E. coli, Candida, and Staphylococcus aureus and so forth. And so certainly associating a product like that with Clamax would certainly absolutely act to completely repair the intestinal permeability. Because I think that it's very important when there's an autoimmune disease, of course, it's very important to intervene in the final causes of it, the CIC, the inflammation. But if you at the same time don't close the hole in the guts that keeps producing those CIC, you risk working for nothing. And so it's absolutely important to work also at that level. But again, phycocyanins are certainly a very, very powerful tool to also restore, the lesions, repair the lesions in the guts, which are wounds essentially, right? So.
Boy, I'll tell you, that just answered the question that I was going to ask perfectly. Thank you.
Okay.
Leaky gut is a big deal, and I'll tell you, a lot of people are dealing with a lot of issues that we can name diseases because of the leaky gut and the toxins from it. So with a lot of food allergy testing and digestive analysis that I've done over the years, if the gut is healed, just about everything goes away.
Yeah, I absolutely believe that it's a fundamental, I don't think there is one fundamental cause of disease, but there's a few, but certainly there are some that are big, and leaky gut is certainly one of them, one of the big ones. And the other thing is, I have to say, a protocol like that, but Clamax already in itself, but again, a protocol with these probiotics I'm talking about, we have amazing results on Crohn, on IBS, on all sorts of intestinal problems very, very rapidly. So actually, I'm hoping to be able to introduce this probiotic in IGALN later on. So
yeah, gut health, the gut issues are just rampant. The yeast, the candida, the H. pylori issues, and so leaky gut, SIBO. This whole issue with the gut is a big issue.
Is there a place?
Actually,
Sorry.
Yeah, go ahead.
Is there a place we can get this probiotic prior to that, or is it available?
Yeah, I can. We've been talking about Dr. Nelson about shipping some products to him. Maybe you can, play as a kind of a, I don't know. I'm wondering maybe to then distribute with you as well. I don't know, but yeah, actually, I'm coming out with a product now, which is called GI Protex, which is exactly a synthesis of that. Contains the probiotics that I'm talking about, together with the Afamax and the high concentration proteolytic enzyme, which I personally find are another very, very important tool in all autoimmune and intestinal diseases. So I'd be happy actually to have some, maybe you can organize a small study together, or something like that, if you guys are available. Yeah.
That'd be great. That'd be great. Thank you.
Oh, I'm sorry. I have one question. I mean, I think that it's a given, but I just want to ask anyway. For example, I have a lot of issues with my patients with adrenals. And of course, the spleen is the base of it. So just wondering, but I think you've already answered it, about the adrenals. What's the effect on them being, because, when you find a patient that has adrenals that are actually like dead, like they cannot come back to the healing form, That's the ones I'm
Right.
struggling with. Like the others one, in a matter of a year or something, I can get them back on track, but not the ones that have like really dead adrenals. So just wondering
Right.
about the effects on that, because you mentioned something. I mean, if it treats IBS and all of the digestive problems, that's one of the main issues
Right.
with renal. So just wondering about that. Sorry.
Yeah, apart from the indirect general system, intervention, that of course, if you put your intestine, your gut in a proper condition, then, many other conditions may be helped and so forth. I think there is a specific activity of the product on the adrenal because, for one thing, again, the stem cells activity in general, of course, concerns all departments of the body and all the physiological structures. So, there could be a help in that respect of restoring kind of a dead tissue. But there's also direct activity through phenylethylamine and the dopaminergic cascade, which is, it's at the base of noradrenaline and its production. So,
Yes.
in that respect, there could be something actually. I mean, maybe if it's completely dead, no. But if it's not, the increase in adrenal activity could be actually quite fast with
Okay.
Climax.
Okay. Good. Thank you.
Thank you.
So Doc, as we look at the, let's say the stem cell release, does it go to the areas of, how does it know where to go? Let's say adrenals, thyroid. How does it go to those areas?
Yeah, I think I've answered that before. What it is this is a theory, of course. It's not tested or proven, but I think it's common sense. And that is, we know for sure, this is proven, that stem cells are, once they're mobilized, once they're released from the bone marrow and get into the bloodstream, are attracted to the site where they're needed by immune cells like cytokines and globulins, right? So the problem is, the reason why this mechanism may not work is because of the so-called silent inflammation, the generalized inflammation. Almost everybody has such level of general inflammation that the message doesn't come anymore. There's so many messages from all over the body that the stem cells don't know where to go. But again, with Climax, you also have a very powerful activity on lowering the general inflammation level, which means at that point, only the message from the lesion may remain because there's a lesion. So it's not due to, bad nutrition, stress, or whatever. It's actually a lesion that is present, and that is going to stay when the silent inflammation is going to be eliminated. So at that point, the stem cells knows where to go because it's called there by the immune cells that are sent out of the inflammatory process that happens at the actual lesion level.
Great.
I don't know if that answers your questions, but
No, I think that answered it. Yes.
All right.
Anything else? Any other questions?
Just one last one. Just I don't want to know exactly, but just you mentioned earlier that there's some iodine in the product. I just was wondering,
Right.
yeah, what like ingredients are in it? Like just kind of like a ballpark. I mean, just iodine, and then the stem cells, obviously.
You mean the minerals that are present?
Yeah.
Yeah, there's I can send you a slide with all the minerals. I mean, there's up to more than 70 minerals, trace minerals. Some of them are actually, some minerals are more present, like iron, a little bit of iodine. I think is molybdenum. There's a lot of vanadium. That's actually, I find, one of the most interesting things, because I haven't talked about the metabolic syndrome, but there's an effect of this product also on metabolic syndrome, because about 15 years ago there was a study done on mice and published in Gastroenterology, where they showed that alpha algae was actually able to inhibit the activity of sucrase and maltase at the intestinal level, lowering the absorption of sugars. The other thing that is maybe very relevant here is exactly as I mentioned, vanadium. Vanadium is the insulinomimetic mineral, the number one together with chromium. And again, there's quite a bit of vanadium. I think in Climax, in one dose of Climax, you may have like more than 50% of the daily requirement, 50-60% of the daily requirement of vanadium, which again is one of those rare minerals that are more and more difficult to find in the diet because are those trace minerals that disappear more quickly from food, for all we know about, industrial agriculture and blah, blah, blah. So that's another, I think, very important element. So I personally have to say that I've seen always very, very good results with the algae and diabetes. I've seen a lot of cases of diabetes 2 normalized, and I've seen a lot of cases of diabetes 1 that after 1 month of being on the product, they would kind of lower, by half the insulin or something like that. And one other thing that could be interesting there that I was working on this recently because we had planned another study in this area. One of the main activators of insulin production is acetylcholine, and again, clamine, it's a very powerful stimulator of acetylcholine production. So there could be another further element. So sorry, I went on the tangent because I thought of vanadium, which is one of the most important minerals present there. But apart from this, in absolute terms, you would say that, it's the highest source of calcium, because in absolute terms, there's, more calcium in algae than dairy, for instance. But of course, we're talking about 1 gram of active, so it clearly cannot be that in relative terms there's little. It's useful, little bit of calcium, but there's not a lot of it. But what I find very relevant on the minerals is that, as I said, there's more than 70 minerals. All the trace elements are there, including gold and silver. In fact, I always say,
Yes.
if you take this product, you become more precious, So those are not, it's not important how much there is of those, it's important that they're there, because they're trace minerals. You only need traces of it, but they're absolutely essential for many, bodily mechanisms.
So just to wrap it up, sorry, the last thing, are there any contraindications, known, like at this moment? Do you have anything?
No, there's no contraindication. The only contraindication is it's not a contraindication, is the fact that I mentioned before, there's a very powerful detox activity. And so at the beginning, some people may experience, some people may experience at the gastrointestinal level, some people may experience it with rashes. Yesterday, I met a lady who had chronic migraines. Her migraines are improving, and she actually expelled like kind of red patches in her temples. So there can be things like that. But clearly, these are not side effects. These are just detox manifestations.
Yeah, just maybe we support the liver or the kidneys before that. There would not be like maybe a very harsh detox process for the patient.
Sorry, go again. I couldn't hear you. Sorry. Can you repeat?
Oh, no. I was just commenting that maybe if we give support to the liver and the kidneys, just to know that if we give this to them, then maybe the detox process would be on them. That's all I'm saying.
Yeah, I would say that probably if people who are particularly intoxicated, if you did a cycle of probiotics, that would probably clear some of the bad stuff, and make it easier afterwards. But that's my experience anyway. Yeah.
Yes.
Question on just a short question here before we wrap up. Dosage on the use of the product, the dosage. What's your recommendation on that?
Yeah. Well, ideally, what I would say is that I mean, if you take it just, to feel better, to have a, better mood, better energy, one dose, half a dose twice a day, it's perfectly fine. Usually it's actually enough for other, also when there are problems. Clearly, if there's more significant issues like Alzheimer, Parkinson, or whatever, I would go with, double that dose at least, and, maybe half a dose 4 times a day or something like that, or a full dose twice a day. That is one thing also that I want to say is that usually I find that when people start with a low dose, they start, I've seen people who started with half a dose or even with one dose, but in situations where there was a lot of problems, I find that that lower dose kind of starts activating the rebalancing and detoxing process, and people get this kind of effects, maybe unpleasant effects. And usually people tend to lower, go down, say, oh, I was taking, I'll stop for a couple of days, or, I'll take even less or whatever. Paradoxically, actually, when that happens, you should double the dose. Because in my experience, I've seen that whenever you're kind of in between this rebalancing process, it's like you don't have enough tools to get over on the other side. And if you double the dose, it's like you're giving, the tools to just move beyond the cleansing, so that's been my experience for 20 years, and it's always worked. So I offer you this suggestion.
I've got a question regarding the packaging process too. You talked about putting it in sachets in the future. Right now, there's 20 servings per container in the powder. Are you looking at making that half serving sachet so that if people wanted to take half in the morning, half at night, they could open up one packet rather than kind of save that packet?
Yeah, that's the idea. The idea is to make a sachet of half a dose and so allow more flexibility that way. But I don't think it's going to happen before next September because one of the problems is that I don't trust giving the product out to other companies because we've had quite a few bad experiences. And so the company that manufactured the product in Italy has actually invested now in getting a very advanced sachet making machine that probably won't be ready until September. So I would say that it's going to come out in September.
Thank you.
Okay. All right.
Okay. Thank you, Doc.
Thank you
for joining us.
Great.
Bye.
Thank you for being there and for asking questions. And I'm sure I'll see. And again, as I mentioned, if we guys want to start discussing about some type of study on, maybe even leaky gut or whatever, I'll be very happy to be part of it and participate in it. Okay?
Sounds
Thank
good.
you.
Thank you.
All right.
Thank you.
Thank you. Take care and see you soon. Bye-bye.